Hello guys, so welcome back to Dr. Arshad Nadeem Awan ultrasound teaching videos. Hope you're all okay, you're all enjoying your life and you're also watching my videos. As you know that in series of ovarian neoplasm, I have already discussed endometrial tumors, germ cell tumors, sex cord stromal tumors. Today the topic of discussion is metastatic tumors of the ovary. It accounts 5 to 10% of the ovarian neoplasm, and usually it's seen that breast and gastrointestinal primary tumors may metastasize to ovaries. If it is from the colonic origin or from the gastric origin, it usually gives rise to a specific mucinous secreting tumor's appearance called as signet ring sign, and that tumor would be called as Krukenberg tumors. So that's specially reserved for the gastric tumors. As far as metastatic tumors of the ovaries are concerned, this usually happens to be bilateral, and if it appears in a cystic form, it mimic as a cystic adenocarcinoma of the ovaries. So therefore, care must be taken. Tumors from the uterus, from the breast, and from the stomach are happens to be solid tumors, while tumors from the colonic origin, it happens to be cystic, multicystic, heterogeneous with irregular margins. Lymphoma are also common in involving the ovaries, and the appearance of the lymphoma is usually appearance as elsewhere, like it will appear as an hypoequic solid tumor. So this is what the appearance of the lymphoma elsewhere in the body. So it will appear on the ovaries the way it appears in the other organs as well. So metastatic tumors, which I have already explained, that the primary may be especially from the breast and from the colonic origin. Uterus and colonic and stomach may also metastasize to ovaries. How it will appear on the ultrasound imaging, how we will appreciate that there will be any particular distinguishing features, or we may give the differential. This is all including in next slide. So let's start watching these images for the better understanding.
This is transvaginal scan, and on this transvaginal scan right ovary is visible. Right ovary is enlarged, and it is occupied by heterogeneous predominantly hypoequic lesion that is actually metastatic deposit. This was a young lady with a 30 years of age, and she had colonic cancer, and her colonic cancer metastatized in both ovaries, so that was a Krukenberg tumors. So these Krukenberg tumors were identified on bilateral ovaries. So look for the image. On this image you can appreciate vascularity, so it's mean that these both metastatic deposits were highly vascular. So it's quite easy to differentiate from the other lesions, because there must be a previous history of carcinoma, and on the basis of carcinoma and previous cancer history you can figure out that this might be deposits, this might be metastatic deposits. Right, so for the other organs and other tumors are concerned, it's quite easy to pick, because sometimes there may be primary malignancy within the ovaries, but in case of metastatic deposit you will be provided with the details and previous medical record that patient has history of colon or somewhere else primary setting. This patient was having colonic cancer, and her cancer was spread in bilateral ovaries. This is another transvaginal scan, and on this transvaginal scan again you can appreciate a well-defined hypoequic lesion, and that is metastatic deposit. This patient had already a colonic cancer, and this was confirmed as a colonic metastatic deposits. Lesion is predominantly hypoequic, and this is known case of colonic cancer. The another point worth noting here, that both the ovaries were involved and there were deposits in bilateral ovaries. Here on this image only one ovary has shown, because the second ovary has already the same characteristics lesion. So this was predominantly hypoequic lesion occupying the entire ovary. Ovary was slightly enlarged. However, the Doppler signal has not shown on this image. This is another transvaginal scan, and on this transvaginal scan, ovary is enlarged, and you can appreciate slightly hyperequic, however heterogeneous mass lesion within the ovary. So this is the right ovary of the patient, and patient had already history of lymphoma. She was a young lady, and her lymphoma was metastasized to bilateral ovaries. Both ovaries had this characteristic lesion, and it was confirmed on histology as well. So whenever you are scanning either transabdominal or transvaginal, always focus for the ovarian lesion, ovarian stroma and ovarian characteristic, because there should have some follicular structures. However, in this, so far this image is concerned, you can't see, you can't appreciate any follicular lesion. So because of the fact it is occupied by metastatic deposit, so therefore no ovarian follicular activity is visible anymore in this ovary. This is confirmed case of bilateral metastatic deposits due to due to lymphoma. Another example of the lymphomatic metastatic deposits in bilateral ovary. Here on this transvaginal scan, you can appreciate well-defined lesion occupying the ovary. Entire ovary is occluded, occupied, and on the Doppler signals you can appreciate vascularity in the peripheral and central part of the metastatic deposits. So patient had already lymphoma, so there was no doubt left, because patient had primary and this could have been metastatic deposits, so it was easy to pick. Mention on the report the structure, the size, echogenicity and its characteristic, and also mention whether it is confined to the to the ovaries, or any of surrounding tissue has been penetrated or encroded, or it is encapsulated, or how much the extension of the lesion is. So these all informations are important to be on the report. So this is the example of lymphoma metastatic deposits in bilateral ovaries. However, the only one ovary has been shown here, but that was deposited in bilateral ovaries.
Yes guys, this was all about the metastatic tumors of the ovary, and in this video I have ended up with all the neoplasm of the ovaries, and hope this will give you sufficient informations. You better watch my all previous videos regarding epithelial tumors, regarding germ cell tumors, regarding sex cord stromal tumors, and this is what the metastatic tumors are. So this is what all the ovarian neoplastic lesion, benign and malignant, has already been discussed. So if you have any question, just drop me message, and with some other new informative video we'll see each other. Till then, take great care of yourself. See you then. Bye bye.